Well, hello, everyone. Thank you so much for joining. Welcome to the Center for Environmental Health's very first CEO call, where we will discuss CEH's impact in 2020 and our vision for the future. I'm Kathy Gerwig. I'm the CEH Board Vice Chair, and we hope to engage you all in dialogue about the field of environmental health, how it's evolving, and to hear about bright spots for our collective future. Joining me are fellow CEH board members, Dr. Michael Dorsey, Bobby Dunphy, Rob Rosenheck. You will also hear from CEH program directors in the Q&A section, including Sue Chang, Judy Levin, Catherine Alcantar, Kaya Allen Sugarman, and Sarah Packer. Please feel free to ask questions throughout the event by messaging the panelists through the chat. I'm very excited to hand it over to my friend and the CEO of CEH, Michael Green, and the Managing Director of Programs, Randall Miller, who will share some brief stories of impact.
Hi, everybody. I'm really excited to be here today. We're at this really powerful moment in time for our work. You know, the Trump administration was a hostile takeover of our federal government. And it was a hostile takeover on behalf of the fossil fuel sector, on the chemical sector, on a bunch of dirty manufacturing sectors. And their whole business model was to make money at the expense of your health and my health and the health of the people we love, and the health of future generations. And the communities that were hit hardest by this are the communities that have historically always been hit hard by environmental injustice. Low-income communities and communities of color. And it was difficult. And then during the presidential campaign, the most amazing thing happened. I was sitting next to my wife during one of the debates, and I don't know if you remember this moment. There was a question about environmental justice. What? Environmental justice was a question on debate that had never happened before. And then Biden, I felt like, did a really good job. And I feel like since he's been in office, the administration's walking the talk. So we have a moment of opportunity right now. And so what we want to do right here is we want to share a couple stories of positive change that are midstream, that are underway and incomplete. We want to do that in order to share with you sort of our journey in this work. So I'm really glad to be here to share this with you. And I'm honored to start by introducing Randall Miller, who is my friend and who I admire greatly. And he's the Managing Director of Programs here at CEH. Randall? You're on mute. Randall, you're on mute.
Apologies, I was actually calling in from my phone line, and I think that line is muted, so we'll try this. So thanks, Michael, and I just want to begin by tipping my hat to our hardworking program staff, some of whom are on the call with us. They're the ones that really make these changes work, and so I just want to acknowledge them. So we've entered into what we think will be a very exciting time at CEH. Externally, the changes made by the new White House and new opportunities here in California have allowed us to shift from a steady drumbeat of resistance to advancing the issues that we all care about. And we're exceedingly lucky at CEH that we're on track this year to strategically grow our staff size by about 1/3 and expand our programming in some key areas. Because of all this change management is our new byword. As we grow our staff and programs, we're centering our core values of maintaining strong, positive internal and external relationships, and maintaining a reliance on inclusive decision-making, even as we focus on questions of impact and sustainability. We're expanding and diversifying our work, advising companies on how they can leverage their position and their purchasing power to reduce the use of toxic chemicals in commerce. As you know, this strategy is a key component of how CEH creates big changes. And we've had some real measurable success eliminating demand for chemicals that harm the health of all people and all living things. Finally, just in terms of our internal change, we're growing our earned income strategies with the expectation that many of the companies that we partner with will eventually begin paying us for our work. This means that your generous philanthropic donations will go even further in underwriting our efforts with organizations that cannot and should not be charged for the work and partnerships we're in with them. Now I want to shift gears for just a few minutes to foodware to spotlight one of our program strategies. To me, one of the most exciting initiatives at CEH today is our work eliminating PFAS chemicals from foodware. We think it's simply wrong that companies sell throwaway, single-use foodware that contains highly toxic PFAS chemicals. Studies show that these chemicals, often called forever chemicals, because they don't break down easily in our bodies or in the environment, migrate from foodware to food, which means we're literally swallowing them when eating off plates that contain PFAS. CEH is currently playing an important national role that we hope will result in not only ending the use of disposable foodware that contains these toxic chemicals, but moves large portions of the foodware market from disposable to reusable products. CEH has been educating the largest school districts in the country about the problem of PFAS in foodware used in their cafeterias. So here's a great example. After speaking to CEH and attending one of our webinars for large institutional purchasers, the New York City School District informed their supplier that they only want foodware that is PFAS-free. This means that over 1 million meals per day eaten by children in a school setting will no longer contain these toxic chemicals that affect reproduction and cause cancer. Now that's big change.
Thanks, Randall. I'm super excited about that campaign because we're really winning. And it feels a lot to me like where we were a few years ago around chemical flame retardants in furniture, where we were at the same spot where we just had so much leverage that we were really just going to transform the entire sector. I want to tell two stories. One's a carrot story and one's a stick story. And that fits how we create change in the world, because as an organization, a lot of our work is directly changing corporate behavior. So the Toxic Substances Chemical Act is the main federal law that sets the rules for companies' use and transparency around when they use toxic chemicals in the United States. And CEH was played a big role in rewriting that law just a few years ago. And among other things, what TSCA requires is that companies, if they're going to import chemicals on the TSCA list into the country, they have to inform the EPA. And usually that also requires saying which communities those chemicals are going to. And then EPA makes this information publicly available. So that's a great source of important information for local regulators or state agencies, and especially for grassroots community-based organizations to know what's happening in their community so they can advocate for themselves about how to keep their communities healthy and vibrant. So during the Trump administration, we were worried that this wasn't happening. So we started to compare. And what we found was that the trade sector reports were showing literally millions and millions of pounds of toxic chemicals being imported into the US that weren't being reported to EPA. There were hundreds of companies that weren't telling EPA about literally millions of pounds of toxic chemicals. And this is important because if EPA doesn't know, then nobody else can actually know to protect local communities. So we're going to make them tell. And so we're starting a process right now we're doing, in essence, a pilot targeting 6 companies that lied about their imports. And we're challenging those 6 companies to report chemicals they're using and where they're using them and where they're coming from. And we planned actually to announce this campaign of these 6 companies as a trial at this small call with a handful of our most important supporters. But the press got ahead of it. And so yesterday we announced the first one, which is Chevron Phillips Chemical Company. Chevron Phillips. So those 2 multi-billion-dollar transnational oil companies, and this is a joint venture chemical company, and they are importing millions of pounds of the carcinogen benzene into East Texas and not telling anybody. So their customers know, but nobody else does. State regulators don't know. Grassroots community-based organizations don't know. Nobody knows. So now we're in the process of suing Chevron Phillips and 5 other companies, and we're forcing them to be transparent. Then what we're going to do is we're going to evaluate the impact of the work. And we're going to decide whether it makes sense for CH to implement a national campaign and literally take on hundreds of companies in late 2021 and in 2022 and beyond to force the kind of transparency that will empower people at the grassroots level. Our goal is for those folks at the grassroots level to know what's in their communities so they can advocate for themselves. So that's a stick tactic. Here's a carrot. We regularly advise companies, this is a core work of ours, regularly advise companies on how they can use their purchasing power in their position to eliminate toxic chemicals from commerce. So when Kathy Gerwig, who is one of my bosses and introduced this call, when she was the environment stewardship officer at Kaiser Permanente, we partnered closely with Kaiser, and we still do. Well, it's not just private companies that have that kind of leverage. Cities have large untapped opportunity to use their purchasing power. So this doesn't, when they take action at the local level like this, it doesn't just protect the people in their city by shifting demand, it also protects everyone, because as there's more and more demand for good things and not for things that make people sick, then everyone everywhere will be protected from toxic chemicals. So there's this initiative called City Health, and it targets the 75 largest cities in the country. And the majority of those cities are actually participating with City Health. And the purpose is to improve health and well-being in the largest cities in the country. So CH is advising City Health in many of these cities, and we're going to be doing even more of that in the future, so that they can use their purchasing power to say, eliminate PFAS from foodware, or toxic chemicals from furniture, or flooring, or cleaning supplies. So imagine you're an executive at a company that makes single-use foodware. And then you get a call, like Randall described, from the City of New York School District with their 1 million meals a day. Then imagine you're getting that same call from a dozen different cities. You're going to get rid of the PFAS. And when you get rid of that PFAS from your product, it's not just going to protect the kids who are eating those school lunches. It's also going to protect the people who live near where the PFAS is manufactured, maybe in North Carolina, and where the foodware is manufactured, maybe in Maine, and where the landfills and the large-scale compost facilities that foodware ends up, and everybody who is affected by what goes into those places. So it's really gratifying work. It's really personally fulfilling for me to get to work with people like I get to work with and create this kind of change in the world. So now I want to introduce a few of the CH board members so that they can share why they're volunteering their valuable time. So let's start with Rob Rosenheck.
Hi, everyone. I am Rob Rosenheck, and I want to tell you a little bit about myself and why I support CH. So I was introduced to my friend Michael Green over 20 years ago by fellow board member Michael Dorsey. And I've been volunteering and advising CH for 20 years. And recently I had the good fortune to sell my company, and I've also now become a donor and a board member. And I've worked for a number of different nonprofits, and I can say confidently that CEH is the most efficient and effective nonprofit organization I've ever worked with. CEH is lean, it's mean, and the work that we do is vital to protect human health. So when CEH removes a chemical from commerce in California, that chemical is usually removed from commerce nationally. So I'm incredibly proud to be part of this organization, and can tell you, as a volunteer, as a supporter, as a donor, that it's a real special, unique group of people here. I'm going to pass it over to my friend and fellow board member, Bobby.
Thank you, Rob. It's an honor to be here, and it's an honor to serve on the board of CEH. I didn't make the decision to come onto the board of CEH lightly, because I do think that board members should be as active as they possibly can. And as time is a precious resource, as Michael Green mentioned, as it is in everyone's lives, it's certainly a very precious resource in mine. I work in and have worked in the climate finance arena for decades now, and I understand well how toxic chemicals are impacting the health and well-being of all living beings. And those include endocrine disruptors such as plastics that are actually having a major impact on reproductive levels in humans and all flora and fauna. I want to say that every single time that I join a board meeting, I learn a new fact about CEH that makes me fall in love with the organization even more. And one of those facts that I learned quite recently was that CEH have a re-grant program where they actually use a portion of the winnings, or what, for a better term, when it happens with a court settlement and CEH wins with the litigation, they actually re-grant some of that back to the local communities that are impacted most negatively by the pollution. And I learned just recently that they did so with a community that was largely Latinx community. These are marginalized communities that are actually impacted by these pollutions more than any other communities on the planet. And with that, they were able to actually enable the community to purchase air filters so they helped empower the local community in relationship to what had been going on with the toxins that were being spewed out by one of the local polluters. And so we're able to actually engage the community in ways that most other organizations don't. They're not legally bound to do this, but it's in the DNA of CEH to get these things right. So again, I'm very proud to be on the board. CEH works very hard to fight the good fight for us all, and for those in the marginalized communities that are largely voiceless. And let's be honest, that's a good fight. And I want to pass over to my dear friend and colleague and board member, Dr. Michael Dorsey, who has also been fighting the good fight for a long time. Thank you.
Bobby, thank you so much. It's really a pleasure to be here with everybody. You know, I love CEH because for me, you know, CEH, the Center for Environmental Health, is the secret sauce in the long-going battle against environmental injustice, in the battle against toxics in our food, in our water, in our air, and the environment broadly defined. I think CEH, over a 2-decade arc that I've seen, you know, working and knowing Michael Green as a friend and as a colleague, has really been at the vanguard, at the cutting edge of delivering environmental justice, recognizing that the toxic soup that we're exposed to day in and day out is really part of that racist, systemic racism that we see and being exacerbated and harming communities on the margins. And really the center has been at the forefront of, like Bobby said, working with communities, sharing the benefits and the resources with communities on the margins to get out ahead of those corporate recidivistic criminals that we know we've got to fight, but at the same time, cutting out a space that says we can do something very, very different. We can have a very, very different environment, and we can do that by bringing all communities along and delivering environmental health for all the time. So that's why I love CEH. And I'll pass it over to Kathy.
Thank you, Michael. What a fantastic board and staff this organization has. And I've been affiliated with CEH for a couple of decades as somebody who does institutional purchasing, as a funder, as a company that hires them for their expertise. And so I think what I wanted to talk about here, why I'm committed to the organization and what excites me about it, is that consistently there are 3 pillars to the work that they do, and you've heard about them already on this call, but to have what they do solidly steeped in science is really critical. And as Michael just said, solidly steeped in environmental justice. And then finally, their approach is extremely collaborative. So they're not about trying to get out there and do it on their own and take solo credit. It's about finding partners that will deliver and working with those partners. So the latest example of that to me, which I'm really excited about, is that PFAS foodware work that Randall talked about. I mean, to already have impacted 1 million meals that get delivered in New York, and to think about scaling on that kind of grand fashion. Again, it started with the science. It is really deeply collaborative work, and CEH just excels at that sort of work that also services environmental justice. So that, as I said, is the latest example. There are many, many examples, and we'd love to talk to you about all of them and whatever interests you. But for now, I'd like to shift us back to the Q&A portion of the meeting and turn it back over to Michael to manage that for us. Hey, Michael.
Hi, Kat. So you can see why I feel so much gratitude for getting to work with the kind of board members you just heard from. And so there's a bunch of program staff who are also here. And I have this whole list of questions. So the first one is, and I think this one is probably best for Sue Chang. With the rise of takeout during COVID, do you see any movement toward reusables or not with the pandemic?
Thanks, Michael. So leading up to COVID-19, CEH was seeing interest from schools in particular in moving to reusables. And then when the pandemic hit, I think there was a lot of confusion, and the shelter in place orders went into effect. So a lot of schools had to immediately go to an all takeout model, and we were not set up for doing reusables in a takeout model in this country, really. But we've been seeing a lot of interest coming back now that schools have been doing this for a while, and they're planning on really what are they going to do when they fully reopen in the fall. Some are actually starting to pilot some reusable containers now while the kids are returning to school, but we're excited by the amount of interest from schools in going to reusables, and also getting out of PFAS and some of these other toxic chemicals in the single-use products.
Great, thanks, Sue. Another question here, and this one I think Sarah might be the best one for, is how are you tackling climate change, if at all?
Thanks for that question. So we are, and we all know that we're facing an existential crisis when it comes to climate change. And we also know that climate change is inextricably linked to the petrochemical and plastic industry, and that the fossil fuel companies are the ones making a lot of the plastics, and that the plastics not only pose a physical hazard, but also toxic hazards for humans and for the environment. We also know that communities that face the greatest threats from climate change also experience the greatest impacts from toxic chemicals. CEH has a strong history of working in the healthy energy space, particularly related to fracking. And now we're taking a very comprehensive look at how we can strengthen our work at the intersections of petrochemicals, plastics, and climate. We're conducting an in-depth landscape analysis to identify strategic opportunities to really undermine this toxic trespass on people's bodies and on the environment. And we're prioritizing approaches that center environmental justice and health equity, and that focus on the needs of and amplify the work of those most affected by the cumulative impacts of climate change, toxic chemicals, and fossil fuels. So more to come soon. We're doing a lot of listening right now, a lot of reading, and we're excited.
Thanks, Sarah. So another one is around policy around PFAS and foodware. So I'm going to pile on to the actual question and say, I know that we're providing a lot of technical assistance to states around the country that are passing different forms of legislation around PFAS in foodware. But maybe, Catherine, this is best for you. Can you tell us a little bit what's happening in California around that? Plus, if you or Sue want to talk about what's happening in other states, that also might be good.
Sure. It's a pleasure to be here with all of you. So the California bill is can you hear me? Because I'm seeing a note to unmute. Okay. So there has been movement on this issue in other states, and CH has been providing that technical expertise, as Michael mentioned, to other states. In California, a number of our sort of national and state allies, including NRDC, Breast Cancer Prevention Partners, EWG, and Clean Water Action, sort of recognize that expertise that we've been providing, and actually came to CEH and wanted us to engage in the bill that they were working on. So, so it was really kind of nice that they recognized the expertise that we had, and so we officially joined as co-sponsor of the bill, and have been working to provide that expertise, but also just helping with the overall strategy of the bill. Because one of the things that is great about this bill is there's three major components. One is that it bans the sale or distribution of plant-based food packaging treated with PFAS, but it also, which is an approach that many states have taken on, but it also does two other things which I think are pretty unique. And one is that it requires cookware and bakeware manufacturers to disclose the product label, to disclose on the product label and online the presence of hazardous chemicals such as PTFE, and a number of other what are considered candidate chemicals of concern on DTSC's list. So it's a pretty long list of chemicals. And so in our mind, it sort of gets at this chemical whack-a-mole issue where if you replace it with another chemical, you still have to say what that chemical is. And so that's why disclosure is a really great approach in this bill. And then the last thing is it would prohibit the misleading advertising on cookware packaging that you might see things that say, oh, it's PFOA free. Well, it still has other PFAS chemicals, it just doesn't have PFOA. And so this bill in particular would prevent that from happening. So those are a number of the components of the bill that we are pushing forward. With respect to, I don't know, Sue, did you want to add anything about what other states are doing?
Well, I think there's just a lot of interest and movement in several other states around the country I think some are even going further and including other chemicals in foodware to restrict, as well as just other types of products. And Connecticut is looking at all packaging actually and eliminating PFAS.
One interesting thing about this technology that we are using right now is that people in the audience can only chat the panelists, but the panelists can chat everybody. So we're figuring that out literally on the fly. And so in the chat, everyone can see Sue's answer, but they can't see Nico's question. So I'll just tell you what the question was. The question was, what is the legislation, the California state legislation that we were talking about? And so then you can see the answer is AB 1200. This is fun having to deal with texts and messages and the questions in the chat. Okay, so here's the next question, and that is, I got to scroll up to read this one. It says, oh, it's related to the TSCA litigation and the enforcement of transparency around TSCA that I spoke about earlier. And so the question is, if those companies who fail to report the chemicals that they're using, will they get fined or penalized in a significant way by EPA? And if not, why not? So we are demanding of EPA that they fine, for example, the story that I told about Chevron Phillips Chemical Company. That is our request of EPA. We don't obviously have any control over it. Right now, we don't know what EPA is going to do about that, but it is our aspiration that there's two good pieces of policy. One important piece about policy is, what does the law actually say? So folks on this call actually helped to make sure that the new version of TSCA that passed a few years ago has really strong language. Then the second half is the implementation. And so that depends on EPA, in this case, creating the disincentive for companies to hide the ball by creating a cost when they do so. Now we're creating a cost to Chevron Phillips by talking about it in the press. There's an article in Reuters. I think there's going to be a Bloomberg article today, et cetera. But financial costs also would be valuable. So we're hoping that that happens. And it's also, there's another question about, are we working with the Biden administration? So that's an example. We have a petition around PFAS in water in North Carolina, and we are, while we're playing hardball with EPA, we're also, we are aspiring that our communication with them will be at a higher level than before, when we basically were just told by the Trump administration, talk to the hand about PFAS in drinking water in North Carolina. Does anybody want to say anything more about what's going on in North Carolina and PFAS in drinking water? That's my question. No one asked that one.
Well, I can just add that, as Michael mentioned, EPA denied our petition to require to the EPA to require the testing for health and safety that Chemours bear that burden financially. So we have been in communication with them. We filed a intent to sue and are in a stay with them, as the EPA has asked, since they have a new administration. They're in the process right now of figuring out a broader PFAS strategy. And so they've asked us to hold off, and they asked us for more time, but we held them to only 60 days. So 60 days or now less, we will either they're going to agree to our petition or we will move forward with our litigation. So that's the status, Michael.
Great, thank you, Catherine. So here's another question. I feel like I saw antimicrobial everything during the pandemic. It's written in the past tense, but I think it's also relevant for the current tense. What do you think of them? And Judy, I'm wondering what you think about this.
Thanks, Michael, and welcome everybody. Yes, there are antimicrobials in so many products now, and unfortunately, a lot of them are being added really just to prey upon our fears and also the misconceptions that we all have that antimicrobials are a good thing, that they'll protect us from COVID or whatever else. Unfortunately, there really is no evidence currently that in many consumer products or building materials that these antimicrobials do anything to reduce the spread of infection or make us healthier people. And unfortunately, there's also evidence that they do cause problems, both to human health and to the environment. So some of the most common antimicrobials you may have heard of are quats, or quaternary ammonium compounds, and they've been linked to respiratory problems. Well, in COVID, that's part of your body system that's being heavily affected. And so these things that are supposed to be protecting our health may in fact be harming our health. We know that they can also there's a potential to create superbugs or bugs that are resistant to antimicrobial treatments, and that becomes a huge public health issue. They get out into our environment, they get into our wastewater, they get out everywhere, and they can be very, very persistent. And it can also lead to a false sense of security. If you think everything is treated with the antimicrobials, you may avoid doing the very things that we know actually do work, which is washing your hands, wearing a mask, social distance, all those good things. So my advice would be to avoid products that are being marketed antimicrobial or antibacterial, unless there is evidence that's been shown that they reduce the spread of infection, which we have not yet found. These products actually may cost more, and by avoiding them, you're protecting not only your health, but the environment. So thanks for asking that question.
Okay, I'm getting a new insight as to what it's like to be a reporter managing the different questions and comments. Another one is, so many organizations had a tough financial year in 2020. How is CH doing financially? So first of all, it is the number one bullet on job description for my position to wake up at 3 a.m. worrying about where the money's going to come from. And that definitely has not gone away. Having said that, we are on solid financial footing. Randall said that we're actually expanding staff. There are a couple positions that we are longtime vacancies that we didn't fill because of financial reasons that we are filling, plus we're creating some new positions. So while we want to be really careful, we're also feeling like we can create even more impact by bringing on some very specific roles that we're looking forward to. So that's where we're at with that. There is another question. So a little bit more about the things that we might do with the Biden administration. So there's some, maybe Catherine, do you want to talk about that instead of me?
Sure.
If there are there other things that you can think of that might be things that we might do with the Biden administration?
Absolutely. So I think, the Biden administration has both Biden and Kamala Harris have both made a commitment to EJ. And so I think that there was a really important state EJ law that was passed in New Jersey last year, and folks are looking to incorporate that and others in advancing EJ policy at the federal level. So this is really an important opportunity for us to think about. There's also other, toxic chemical policies that we're looking towards addressing, including CH just signed on to the Baby Food Safety Act, which would remove heavy metals out of baby food, including baby formula. And we are engaging in legislative education and strategizing with the other sponsors of that bill at the federal level. And then of course, the PFAS work there, it's just such natural attention right now that having the administration in support of that is an opportunity to push forward, but also to hold them accountable, not just to PFAS, but also to the promises for EJ. And so it's just, I don't know, I feel like it's a wonderful opportunity for us to be engaging at the federal level with the commitment from leadership to address these issues that are so important to CEH and to the communities that we're working with.
Thanks, Catherine. Okay, so I think that I'm trying to figure out whether we can squeeze in one more question. I think we shouldn't. I think it's better to make sure we end on time. So I want to thank everyone from senior program staff who obviously you can tell how much incredible expertise they have, and also the board members and Randall. And I want to send it back to you, Kathy. Thank you very much.
Thanks so much, everyone, for participants for asking your questions, and you, I hope, appreciate the expertise that's at our disposal through CEH. Thank you for attending this first of, I hope, many CEO calls, and we really do appreciate all of your support of our mission. And we mentioned the annual report earlier. It truly is a document. I've delved into it, and it's packed with really valuable information. So the link to that annual report will be in the chat, and I really do recommend taking a look at that. There's another event I want to give a plug to, which is next Friday, the 21st. There's another virtual town hall, and this one has two amazing speakers, Dr. Shauna Swan and Dr. Tyrone Hayes. And they're going to be talking about how toxic chemicals are affecting reproduction. And the link for that is also in the chat for you to RSVP. And I very much hope to see you there. Thank you again. We really appreciate all of your support and hope you have a great rest of your day. Thank you. Take care.
Bye, everybody.